Hello everyone, welcome to our Windstroke webinar brought to you by LAMP AccuWellness Foundation Inc. as part of its continuing LAMP lecture series. Today we shall talk about treatment for hemiplegia, aphasia, high blood pressure, and facial paralysis. The treatment for attack of the channels only is exactly the same as for the sequelae stage of attack of the internal organs. During the acute stage of windstroke from attack of the internal organs, Chinese medicine plays only a secondary role to Western medicine. During the sequelae stage, or in attack of the channels alone, Chinese medicine plays a primary role. Acupuncture in particular gives excellent results in the treatment of hemiplegia and facial paralysis. Time factor is very important. Best results are obtained if treatment is given within 1 month of the attack. More than 6 months after its occurrence, treatment becomes increasingly difficult. Normally, paralysis of the leg responds to treatment better than that of the arm, and large joints respond better than small joints. General principles of treatment: remove obstructions from channels, extinguish wind and resolve phlegm, invigorate the lu connecting channels, move qi and invigorate blood in the channels. Hemiplegia is obstruction of channels by wind and phlegm. Pronounced stiffness of joints and contraction of muscles indicates blood stasis. Pathogenic factors obstruct channels against the background of qi, blood, or yin deficiency. According to Zhu Zhenheng, in his book The Essential Method of Danzi, windstroke is mostly due to blood deficiency and phlegm. One must first resolve phlegm and then nourish and invigorate blood. Hemiplegia is due to phlegm in general. If the left side is affected, it is due to blood deficiency and stasis. If the right side is affected, it is due to phlegm, fire, and qi deficiency. In treating unilateral paralysis of the limbs, more points from yang channels are selected because yang corresponds to movement and agility. Points of the affected or paralyzed side are chosen, and they are needled with reducing method if within 1 month of the stroke, or with even method if more than 1 month has elapsed. The points are reduced because it is wind and phlegm in the channels that caused the paralysis. Relatively thick needles must be used, at least 0.34 millimeter or 32 gauge in diameter. It is essential to obtain a good needling sensation, and it is even better if this propagates down the channel. Under a different method, the duration of the condition determines the side of needling, distinguishing between the condition of less than 3 months or more than 3 months duration. If the windstroke occurred within the last 3 months, the points of the paralyzed side are needled with reducing method, and the corresponding points of the healthy side are needled with reinforcing method. This is because in the first few weeks after the stroke, the channels of the affected side are in a full condition. They are obstructed by wind and phlegm. The channels of the healthy side are in a relatively empty condition. If the windstroke occurred more than 3 months previously, the points of the affected side are needled with reinforcing method and moxa, and the corresponding points of the healthy side with reducing method. This is because after 3 months, the pathogenic factors, the wind and phlegm in the channels of the paralyzed side, have moved deeper and also moved on to the healthy side. Obstruction of the channels of the affected side by pathogenic factors leads to malnourishment of the channels. Thus, the channels of the affected side are empty in relation to those of the healthy side. In any case, the points chosen consist of 2 groups, one of general points to extinguish wind and one of points to remove obstruction from the channels. Treatment principle: tonify qi, invigorate blood, remove obstructions from the channels, and invigorate the connecting channels. The points to extinguish in wind in general are Du 26, Du 20, Bladder 7. Du 26 or GV 26, Renzong, water trough, located on the face at the junction of the superior third and middle third of the philtrum. Crossing point on the Du vessel with the large intestine and stomach meridians. Functions: resuscitates, treats acute lumbar sprain, benefits the nose. Du 26 is used for emergency treatment, needling, oblique insertion upwards, 0.3 to 0.5 Sun. Du 20, Bai Hu, 100 meetings, located on the head, 5 Sun directly above the midpoint of the anterior hairline or at the midpoint of the line connecting the apices of the two auricles. Crossing point on the Du vessel with the 6 Yang meridians, C of marrow point. Raises Yang, treats prolapse, subdues Yang, clears the head, calms the Shen, dispels interior wind. Needling, subcutaneous insertion, 0.5 to 0.8 Sun. Urinary bladder 7, Tongtian, celestial connection. Located on the scalp, 4 Sun posterior to the anterior hairline, 1.5 Sun lateral to the midline. Benefits the nose, expels wind, clears the head. Needling, subcutaneous insertion, 0.3 to 0.5 Sun. To remove obstructions from the channels, paralysis of the arm, LI15, TB14, LI11, LI10, TB5, LI4, TB3, SI3. Paralysis of the leg, bladder 23, GB30, GB29, stomach 31, GB31, stomach 32, bladder 40, GB34, stomach 36, bladder 57, GB39, stomach 41, bladder 60, and GB40. Large intestine 15, Xian Yu, shoulder bone. When the arm is abducted 90 degrees laterally or forward, the point is on the deltoideus of the shoulder, in the depression of the anterior superior portion of the shoulder. Crossing point of the LI meridian with the Yang Chao vessel. Benefits the shoulder joint, expels wind dampened wind, alleviates pain, circulates qi in meridian. Needling, perpendicular or oblique downward insertion, 0.8 to 1.5 Sun. Sanjiao 14 or triple burner 14. Xian Liao, shoulder crevice. On the region of the shoulder, when the arm is abducted, the point is posterior to LI15 in the depression posterior and inferior to the acromion. Activates the meridian, alleviates pain, benefits the shoulder, dispels wind damp. Needling, perpendicular insertion toward the shoulder joint, 1 to 1.5 Sun. Large intestine 11, LI11, Kuchi, pull at the crook. With the elbow flexed, the point is on the lateral end of the transverse cubital crease, at the midpoint between LU5 and the lateral epicondyle of the humerus. Hisi point of the large intestine meridian. Clears heat, cools blood, resolves dampness, expels exterior wind, regulates qi and blood, activates meridian, relieves itching. Hisi points are where the qi of the meridian collects and goes deep into the body. Hisi points treat rebellious qi and diarrhea. Needling, perpendicular insertion, 1 to 1.5 Sun. LI10, Sao San Li, arm 3 miles. With the elbow flexed, the point is on the dorsal radial side of the forearm, on the line connecting LI5 and LI11, 2 Sun below the transverse cubital crease. Regulates qi and blood, tonifies qi, activates the meridian, stops pain. Needling, perpendicular insertion, 0.8 to 1.2 Sun. Sanjiao 5, Wai Guan, outer pass. On the dorsal aspect of the forearm, on the line connecting SJ4 and the tip of the elbow, 2 Sun above the transverse crease of the wrist between the ulna and radius. Lu connecting point of the Sanjiao meridian. Master point of the Yang Wei vessel coupled with gallbladder 41. Dispels wind heat, releases the exterior, benefits the ears, activates the meridian, alleviates pain. SJ5 is a very important point to use for releasing exterior wind heat. Loop connecting points of one meridian can communicate with two meridians. They treat diseases of the collaterals and can be used to treat chronic diseases, especially chronic diseases of the Zhangfu organs. Clinically, loop connecting points are often combined with the yuan source points in the treatment of diseases. Li4, Heku, joining valley, on the dorsum of the hand between the first and second metacarpal bones, in the middle of the second metacarpal bone on the radial side. Yuan source point of the large intestine meridian. Command point of the head and face. Expels wind and releases the exterior, tonifies qi and strengthens immunity, stops pain, regulates the face and head area, induces labor. Li4 is a very common and useful point. It is useful for any condition related to the face and head. It's also particularly useful for wind heat conditions like flu. Li4 is known as the pain point in the body. Anywhere there is pain, use Li4. Clinically, yuan source points are of great significance in treating diseases of the internal organs. Yuan source points are the sites where the yuan qi of the Zhangfu organs passes and stays. Puncturing the yuan source point stimulates the vital energy of the regular meridians, regulates the functional activities of the internal organs, reinforces anti-pathogenic factors, and eliminates pathogenic factors. This method of treating diseases deals principally with the root causes. The yuan point from the affected meridian is often combined with the loop connecting point of the internally-externally related meridians in use. Perpendicular insertion 0.5 to 1 Tsun, do not needle during pregnancy. Sanjiao 3 or triple burner 3, Cheongju, central eyelet. On the dorsum of the hand in the depression between the 4th and 5th metacarpal bones, proximal to the 4th metacarpophalangeal joint. Shoestring point of the Sanjiao meridian, clears heat, dispels wind, benefits the ears, eyes, and head, activates the meridian, alleviates pain. Shoestring points are where the qi starts to pour down the meridian. They are known to alleviate heaviness and pain in the joints. Needling, perpendicular insertion, 0.3 to 0.5 Tsun. Si3, Ho, Si, backstream. When a loose fist is made, the point is on the ulnar aspect of the hand, proximal to the 5th metacarpophalangeal joint, at the end of the transverse crease of the metacarpophalangeal joint at the junction of the red and white skin. Shoestring point of the small intestine meridian. Master point of the Du meridian coupled with bladder 62. Benefits the neck and back, activates the meridian, expels exterior wind, regulates the Du meridian, calms the Shen, treats malaria. Si3 is an excellent point for neck and back issues when coupled with bladder 62. Needling, perpendicular insertion, 0.5 to 1 Tsun. Urinary bladder 23, Sen Su, kidney shoe. On the back, 1.5 Tsun, lateral to the lower border of the spinous process of the second lumbar vertebra. Bakshu point of the kidney. Strengthens the kidneys, tonifies kidney yang, nourishes kidney yin and essence, strengthens kidney's ability to grasp qi, benefits the ears and bones, strengthens the low back, resolves dampness. Bladder 23 is one of the most effective points to tonify the kidneys. Bakshu points are corresponding points on the back where the qi of the respective Zhangfu organ is infused. If the 5 Zhang organs are diseased, abnormal reactions appear on the Bakshu points. Bakshu points have a direct therapeutic effect on the diseases of the 5 Zhang organs. Needling, perpendicular insertion, 0.5 to 1 Tsun. Gallbladder 30, Huan Tia. Jumping round. On the lateral side of the buttocks, when the patient is in the lateral recumbent position and the thigh is flexed, this point is at the junction of the lateral third and medial third of the line, connecting the greater trochanter and the hiatus of the sacrum. Crossing point of the gallbladder and urinary bladder meridians. Activates the meridian and removes obstructions, benefits the hips and legs, resolves wind damp, relieves pain. GB30 is a common and important point in the treatment of sciatica. Needling, perpendicular insertion, 2 to 3 tsun. Gallbladder 29, Duliao, squatting crevice. On the region of the hip, at the midpoint of the line connecting the anterior iliac spine and the great trochanter of the femur. Crossing point of the gallbladder meridian and the yang chow vessel. Activates the meridian and removes obstructions, benefits the hips and lower extremities, relieves pain. Needling, perpendicular insertion, 1 to 1.5 tsun. Stomach 31, big one, thigh gate. On the anterior aspect of the thigh, on the line connecting the anterior superior iliac spine and the lower lateral border of the patella, level with the lower border of the symphysis pubis in the depression on the lateral side of sartorius muscle when the thigh is flexed. Frees obstructions in the meridian, dispels wind damp, alleviates pain. Needling, perpendicular insertion, 1 to 2 tsun. Gallbladder 31, feng shui, wind market. On the midline of the lateral aspect of the thigh, 7 tsun above the transverse popliteal crease. When the patient is standing erect with the hands hanging down close to the sides, the point is where the tip of the middle finger touches. Dispels wind, activates the meridian, relieves itching, relieves pain. GB31 is an empirical point to treat itching. Needling, perpendicular insertion, 1 to 2 tsun. Stomach 32, Futu, crouching rabbit. On the anterior aspect of the thigh, on the line connecting the anterior superior iliac spine and the lower lateral border of the patella, 6 tsun above the patella. Frees obstructions in the meridian, dispels wind damp, alleviates pain. Needling, perpendicular insertion, 1 to 2 tsun. Urinary bladder 40, Wei Tsung, supporting middle. Midpoint of the transverse crease of the popliteal fossa between the tendons of biceps femoris and semitendinosus. Hisi point of the urinary bladder, command point of the low back. Clears heat, resolves dampness, benefits the lumbar area and knees, cools the blood, clears summer heat, activates the meridian, relieves pain. Urinary bladder 40 is an excellent point for any low back condition, acute or chronic. It is also known to help skin conditions. Needling, perpendicular insertion, 1 to 1.5 tsun, or prick the popliteal vein with a 3-edged needle to cause bleeding. Gallbladder 34, Yang Ling Chuan, Yang Heel Spring. On the lateral aspect of the lower leg, into depression, anterior and inferior to the head of the fibula. Hisi point of the gallbladder meridian, converging point of sinews, benefits the sinews and joints, activates the meridian, moves liver qi, harmonizes the Shaoyang, relieves pain. GB34 is a very good point to move liver qi and to treat anything related to the sinews. Needling, perpendicular insertion, 1 to 1.5 tsun. Stomach 36, Susan Lee, leg 3 miles. On the anterior aspect of the lower leg, 3 tsun below ST35, 1 finger breath using the middle finger from the anterior crest of the tibia. Hisi point of the stomach meridian, command point of the abdomen, point of the sea of water and grain. Tonifies qi and blood, harmonizes and strengthens the spleen and stomach, strengthens the body and weight qi, raises yang, calms the shen, activates the meridian, stops pain. Stomach 36 is known as one of the most important points to tonify qi and blood and promote general wellness. Needling, perpendicular insertion, 1 to 2 tsun. Urinary bladder 57, Changshan, supporting mountain. On the posterior midline of the lower leg, between bladder 40 and bladder 60, when extending the toes straight or lifting the heel, the point is below muscle gastrocnemius in the apex of the depression. Relaxes the sinews, activates the meridian, treats the heel and foot, empirical point for hemorrhoids. Needling, perpendicular insertion, 1 to 2 tsun. Gallbladder 39, Shanchung, suspended bell. On the lateral aspect of the lower leg, 3 tsun above the tip of the external malleolus on the anterior border of the fibula. Converging point of marrow. Strengthens the sinews and bones, nourishes marrow, activates the meridian, dispels wind dampness, relieves neck pain, relieves pain. Needling, perpendicular insertion, 1 to 1.5 tsun. Stomach 41, GSG, stream divide. at the junction of the dorsum of the foot and the lower leg, in the depression at the midpoint of the transverse crease of the ankle, between the tendons of extensor hallucis longus and digitorum longus, Jing River point of the stomach meridian. Clears heat from the stomach end meridian, calms the shen, activates the meridian, removes obstructions, and stops pain. Jing River points are where the qi of the meridian begins to flow more heavily. They are known to treat cough and asthma due to pathogenic cold or heat. Needling, perpendicular insertion, 0.5 to 1 tsum. Urinary bladder 60, Kunlun, Kunlun Mountains. On the foot, behind the external malleolus, in the depression between the tip of the external malleolus and tendocalcaneus. Jing River point of the urinary bladder meridian. Expels wind, clears heat, relaxes the sinews, removes obstructions from the meridian, promotes labor. Bladder 60 is an important point to help ease difficult labor. Needling, perpendicular insertion, 0.5 to 1 tsum. Gallbladder 40, Kayakchu, heel ruins. On the foot, anterior and inferior to the external malleolus, in the depression on the lateral side of the tendon of the extensor digitorum longus. Yuan source point of the gallbladder meridian. Moves liver qi, activates the meridian, benefits the joints, relieves pain. Needling, perpendicular insertion, 0.5 to 0.8 tsum. Only 3 or 4 points should be used each time for each limb. Points are also selected according to joint involved. They should be needled rather deep, and intramuscular penetration of 2 points with 1 needle is often used. For example, LI15 to LI14, stomach 36 to stomach 37, TB5 to PC6, LI11 to heart 3, GB34 to spleen 9, GB39 to spleen 6. Although more yang points are used, points from the yin channel should not be overlooked. Yin points are particularly indicated in conditions of more than 6 months duration where there is pronounced stiffness and contraction of the limbs. Ren 23, heart 5, kidney 6. These points are needled with reducing method if the wind stroke occurred within 1 month, and even method if more than a month has elapsed. Ren 23 eases the throat and promotes speech. Heart 5 resolves phlegm and opens orifices. Heart controls tongue and speech. Kidney 6 benefits the throat. Ren 23 or conception vessel 23. Lian Chuan, corner spring. On the anterior median line of the neck, above the throat prominence, in the depression above the upper border of the hyoid bone. Crossing point of the Ren and the Yin Wei vessels. Subdues rebellious qi, benefits the tongue, throat, and speech, resolves phlegm, stops cough. Needling, oblique insertion towards the tongue root, 0.5 to 0.8 tsum. Heart 5, Tong Li, connecting interior. On the palmar aspect of the forearm, the point is on the radial side of the flexor carpi ulnaris tendon, 1 tsum above the transverse crease of the wrist. Lu connecting point of the heart meridian. Calms the shen, benefits the tongue, regulates heartbeat. Heart 5 is a very good point to tonify heart qi. Needling, perpendicular insertion, 0.3 to 0.5 tsum. Kidney 6, Jiao Hai, shining sea. On the medial aspect of the foot, in the depression below the tip of the medial malleolus. Master point of the yin chao vessel, coupled with lung 7. Nourishes the kidneys, clears deficiency heat, regulates the yin chao vessel, benefits the throat, benefits the eyes, calms the shen. Kidney 6 is one of the best points to nourish kidney yin. Needling, perpendicular insertion, 0.3 to 0.5 tsum. If the blood pressure is raised, it is important to take measures to lower it because this can be a predisposing factor for further strokes. LI4, liver 3, reducing. Kidney 3, reinforcing. Stomach 36, gallbladder 39 with moxibustion. Stomach 9, pericardium 6, spleen 6 are tapped with plum blossom needle. LI4 and liver 3 subdue liver yang and extinguish liver wind. Kidney 3 tonifies kidney and liver yin. Stomach 36, gallbladder 39 together reduce blood pressure. Stomach 9, empirical point to reduce blood pressure, especially in combination with pericardium 6 and spleen 6. Li4, Heku, joining valley, on the dorsum of the hand between the first and second metacarpal bones, in the middle of the second metacarpal bone on the radial side. Yuan source point of the large intestine meridian, command point of the head and face. Expels wind and releases the exterior, tonifies qi and strengthens immunity, stops pain, regulates the face and head area, induces labor. Li4 is a very common and useful point. It is useful for any condition related to the face and head. It's also particularly useful for wind heat conditions like flu. Li4 is known as the pain point in the body. Anywhere there is pain, use Li4. Needling, perpendicular insertion, 0.5 to 1 soon. Do not needle during pregnancy. Liver 3, Tai Chung, great surge, on the dorsum of the foot, in the depression proximal to the first metatarsal space. Yuan source point of the liver meridian, shoestring point of the liver meridian. Regulates liver qi, subdues liver yang, regulates menstruation, calms the shen, nourishes liver yin. Liver 3 is a very important and commonly used point. It is often coupled with Li4, known as the four gates, to effectively move qi and blood throughout the body. Needling, perpendicular insertion, 0.5 to 0.8 soon. Kidney 3, Tai Si, great stream, on the medial aspect of the foot, posterior to the medial malleolus, in the depression between the tip of the medial malleolus and tendocalcaneus. Yuan source point of the kidney meridian, shoestring point of the kidney meridian. Tonifies the kidneys, yin and yang, strengthens the low back, relieves heel or ankle pain. Kidney 3 is important to use for any kidney deficiency pattern. Needling, perpendicular insertion, 0.5 to 1 soon. Stomach 36, Zhu San Li, leg 3 miles. Hisui point of the stomach meridian, command point of the abdomen, point of the sea of water and grain. Gallbladder 39, Shen Jung, suspended bell, on the lateral aspect of the lower leg, 3 tsun above the tip of the external malleolus on the anterior border of the fibula. Converging point of marrow, strengthens the sinews and bones, nourishes marrow, activates the meridian, dispels wind dampness, relieves neck pain, relieves pain. Needling, perpendicular insertion, 1 to 1.5 soon. Stomach 9, Jan Ying, man's welcome, on the neck, lateral to the Adam's apple, on the anterior border of sternocleidomastoideus muscle, where the common carotid artery pulsates. Crossing point of the stomach and gallbladder meridians, window of the sky point, sea of qi point. Regulates qi and blood, subdues rebellious qi, benefits the throat and neck. Needling, keep away from the common carotid artery. Perpendicular insertion, 0.3 to 0.8 soon. No moxa. Do not puncture deeply. Pericardium 6, Nei Guan, inner gate, on the palmar aspect of the forearm, 2 tsun above the transverse crease of the wrist, on the line connecting pericardium 3 and pericardium 7, between the tendons of palmaris longus and flexor carpi radialis. Loop connecting point of the pericardium meridian. Master point of the yin wei vessel coupled with spleen 4. Opens the chest, regulates heart qi, calms the shen, harmonizes the stomach, relieves nausea and vomiting, regulates qi. Pericardium 6 is an extremely popular and useful point. It is very helpful in treating insomnia and calming the shen. It also is the point to use for nausea and vomiting. It can be used for any condition related to the chest. Needling, perpendicular insertion, 0.5 to 1 soon. Spleen 6, San Yin Jiao, 3 yin intersection, on the medial aspect of the lower leg, 3 tsun above the medial malleolus, on the posterior border of the medial aspect of the tibia. Crossing point of the spleen, kidney, and liver meridians. Strengthens the spleen and stomach, resolves dampness, harmonizes the liver, strengthens the kidneys, nourishes blood and yin, regulates menstruation, cools and invigorates the blood, benefits urination, calms the shen. Spleen 6 is one of the most commonly used points and one of the most versatile. Because the point crosses the spleen, kidney, and liver meridians, it can treat many conditions associated with all three organs. It is an important point in the treatment of any digestive, gynecological, and emotional condition. Needling, perpendicular insertion, 1 to 1.5 tsun. Do not needle during pregnancy. The facial paralysis following a stroke is called central facial paralysis in Western medicine because it arises from the central nervous system. Peripheral facial paralysis occurring without a stroke is due to injury of the peripheral nerves alone. In facial paralysis following windstroke, the nerves above the eyes are not affected. The movement of the eyebrows and furrowing of the forehead are normal. In peripheral facial paralysis, the patient will be able to move only one eyebrow when trying to frown, and furrowing of the forehead will not occur on the paralyzed side. In other words, the two most prominent signs in facial paralysis following a stroke are deviation of an eye and the mouth. Although the etiology of central and peripheral facial paralysis is different, treatment with Chinese medicine is similar for both. Thus, the treatment recommended here for facial paralysis following a stroke applies also to peripheral facial paralysis, Bell's palsy. From a Chinese perspective, facial paralysis following a stroke is due to internal wind, whilst Bell's palsy is due to external wind. On examination, one should ask the patient to close the eyes, bulge the cheeks, grin, and whistle for the site and extent of paralysis to be ascertained. The eye on the paralyzed side will not close completely. The mouth will deviate towards the unaffected side, and the lips on the paralyzed side will not move on attempting to grin. This will also provide a guideline for the selection of local points. Treatment of facial paralysis is based on distal and local points. The distal points are needled with reducing method if the paralysis is of less than 1 month's duration, and even method if it has persisted longer. For very prolonged cases, moxa with small cones may be used, and also cupping on the cheek with small cups. Only 1 distal point and 3 to 5 local ones on the paralyzed side are normally selected. Distal points, Li4, triple burner 5, depending on channel principally involved, and combination of Li4 and liver 3. Local points, GB14, horizontal, downwards, bladder 2, horizontal, downwards, or towards Yuyayo. Yuyayo, horizontal, towards bladder 2. Triple burner 23, towards Yuyayo. GB1, towards Yuyayo. Stomach 2, horizontal downwards, SI18, horizontal towards LI20. LI20, horizontal towards SI18, stomach 7, horizontal towards stomach 4, stomach 6, oblique towards ST4, ST4, horizontal towards ST6, LI19, horizontal towards LI20, REN24, horizontal towards stomach 4, DO26, horizontal towards LI19. Adjacent points, triple burner 17, oblique towards opposite eye, deep puncture, 1 tsun. Gallbladder 20, oblique towards the eye on the same site. An empirical method for the treatment of facial paralysis consists of pricking certain points inside the cheek. These are 9 extra points between the rows of teeth arranged in 3 rows of 3 points each, with 0.2 tsun between each row and 0.2 tsun between points in each row. These points are pricked to cause slight bleeding, and then cupping is applied to the cheek outside. The points are pricked from top to bottom and from left to right. Distal points, combination of Li4 and LV3 called the 4 gates, expels wind from the face. Adjacent points, triple burner 17. Some doctors say that if this point is needled deep enough with a good needling sensation, other local points are unnecessary. They say this point should be used if there is tenderness on the mastoid process. The four gates is an acupuncture point combination consisting of two different points needled bilaterally. One point, Li4, is on the dorsum of the hand. The other point, liver 3, is on the dorsum of the foot. Li4 is immune booster or pain reliever. This point is great to use for many different conditions. It is used to strengthen one's immune system or decrease the duration of colds and or the flu. It can also be used for any type of problem with the face, which includes jaw pain, toothache, allergies, acne. It is also a great point to relieve a headache or to clear heat and inflammation anywhere in the body. Liver 3, keeping things moving. In my opinion, this is one of the most commonly needled points on the body. It can balance, tonify, or disperse stagnant liver energy. It can be used for any liver energy disharmony. Just a few examples of this include menstrual disorders or irregularities, headaches, dizziness, and detoxification. It can also be used to create a calming effect on the nervous system to alleviate insomnia, irritability, stress, and anxiety. Together, these points work to circulate the qi and blood through the body. They help to open all the meridians, increase circulation, and decrease pain anywhere in the body. The four gates can also be used for emotional issues, as well as such feelings of being trapped or stuck in a situation. This is a great point combination to help maintain the free flow of qi and blood through our bodies. Sanjiao 5 or Triple Burner 5. Y Guan Outer Pass. On the dorsal aspect of the forearm, on the line connecting SJ4 and the tip of the elbow, Tutsun above the transverse crease of the wrist between the ulna and radius. Lu connecting point of the Sanjiao meridian, master point of the yang wei vessel coupled with gallbladder 41. Dispels wind heat, releases the exterior, benefits the ears, activates the meridian, alleviates pain. Sanjiao 5 is a very important point to use for releasing exterior wind heat. Gallbladder 14. Yang Pai, Yang White. On the forehead, directly above the pupil of the eye, Wan Tsun, superior to the eyebrow. Crossing point of the gallbladder meridian and the yang wei vessel. Functions: dispels wind, benefits the eyes and head, relieves pain. Needling, subcutaneous insertion, 0.3 to 0.5 Tsun. Urinary bladder 2. Sun, Ju, bamboo gathering. On the face, in the depression on the middle end of the eyebrow, on the supraorbital notch. Benefits the eyes, clears heat, expels wind. Needling, subcutaneous insertion, 0.5 to 0.8 Tsun, or prick to cause bleeding. No moxa. Yuyoyo, fish lumbus. In the hollow, at the midpoint of the eyebrow, directly above the pupil. Clears heat, removes obstructions from the channel, brightens the eyes. Sanjiao 23, Triple Burner 23, Suju Kong, silk bamboo hole. On the face, in the depression at the lateral end of the eyebrow. Dispels wind, benefits the eyes, alleviates pain. Needling, subcutaneous insertion, 0.3 to 0.5 Tsun. Gallbladder 1, Tongzili Yao, pupil crevice. On the region of the face, lateral to the outer canthus of the lateral side of the orbit. Crossing point of the gallbladder, the small intestine, and Sanjiao meridians. Dispels wind, benefits the eyes, clears heat. Needling, subcutaneous insertion, 0.3 to 0.5 Tsun. Stomach 2, Sibai. 4 whites. On the face, the point is directly below the pupil of the eye, in the depression at the infraorbital foramen. Dispels wind, benefits the eyes, clears heat. Needling. When treating myopia, subcutaneous insertion towards the medial corner of the eye or perpendicular insertion 0.2 to 0.3 Tsun. No moxa. Small intestine 18. Tran Liao, cheekbone crevice. On the face, directly below the outer canthus of the eye, in the depression on the lower border of zygomatic bone. Crossing point of the small intestine and Sanjiao meridians. Expels wind, alleviates pain. Needling, perpendicular insertion, 0.3 to 0.5 Tsun. Oblique or subcutaneous insertion, 0.5 to 1 Tsun. No moxa. Li 20. Yingxiang, welcome fragrance. At the midpoint lateral to the border of the ala nasi in the nasolabial groove. Crossing point of the large intestine and stomach meridians. Dispels wind, opens nasal passages, clears heat. Needling, perpendicular or oblique insertion, 0.3 to 0.5 tsum. No moxa. Stomach 7, siaguan, below the joint. On the face, anterior to the ear, in the depression between the zygomatic arch and the condyloid process of the mandible. Crossing point of the stomach and gallbladder meridians. Clears obstructions in the meridian, benefits the ears, jaw, and teeth. Needling, perpendicular insertion, 0.5 to 1 tsum. Stomach 6, jiatu, jawbone. On the cheek, in the depression, 1 finger breadth using the middle finger, anterior and superior to the lower angle of the mandible, where masseter attaches at the prominence of the muscle when the teeth are clenched. Dispels wind, clears obstructions in the meridian, relieves pain, benefits the jaw and teeth. Needling, perpendicular insertion, 0.3 to 0.5 tsum, or subcutaneous insertion, 0.5 to 1 tsum, or insert towards stomach 4. Stomach 4, D. Kang, earth granary. On the face, lateral to the corner of the mouth, directly below the pupil of the eye. Crossing point of the stomach, large intestine meridians, and the yang chow vessel. Dispels wind, relieves pain, activates the meridian. Needling, oblique or subcutaneous insertion, 0.5 to 0.8 tsum, or puncture towards stomach 6. Li19, Hell Lao, grain bone hole. On the upper lip, right below the lateral margin of the nostril, level with Du26. Dispels wind, opens nasal passages. Needling, perpendicular or oblique insertion, 0.3 to 0.5 tsum, no moxa. Ren 24, or conception vessel 24. Qingjian, container of fluids. On the region of the face, in the depression in the center of the mentolabial groove. Crossing point of the Ren vessel and the stomach meridian. Expels wind. Needling, oblique insertion, 0.3 to 0.5 tsum. 226, or governing vessel 26. Renzong, water trough. Crossing point on the Du vessel with the large intestine and stomach meridians. SJ17, Yifeng, windscreen. Posterior to the lobule of the ear, in the depression between the angle of the mandible and the mastoid process. Crossing point of the sanjiao and gallbladder meridians. Dispels wind, benefits the head or face and ears, clears heat, activates the meridian, alleviates pain. Needling, perpendicular insertion, 0.8 to 1.2 tsum. Gallbladder 20, Feng Shu, wind pool. On the nape below the occiput at the level of Du16, in the depression between the upper portion of sternocleidomastoideus and trapezius. Crossing point of the gallbladder meridian and the yang wei vessel. Dispels exterior and interior wind, clears the head, benefits the eyes, nose, and ears, subdues liver yang, activates the meridian, relieves pain. Gallbladder 20 is an important point to treat any wind cold or wind heat pattern. Needling, oblique insertion, 0.8 to 1.2 tsum, towards the tip of the nose, with the tip of the needle slightly downwards, or subcutaneous insertion through Du16. Towards the middle in the deeper layer is the medulla oblongata. The angle and depth of the needle must be strictly controlled. Thank you very much for your attention.